Hi, my name is Simone Clark, ID number 454403, and today I'll be demonstrating sanitizing, disinfecting, and wrapping of medical instruments. First off, I begin by hand washing. Just for demonstration purposes, we're going to be using the same zinc, but in real life scenario, we're not going to wash our hands where we're sanitizing. I'm going to start by turning on the water on warm, wetting my hands, applying soap, and I'm just going to wash my hands for about 20 seconds. Rinse my hands off. Dry with a paper towel. And turn off the tap and discard the napkin. Then to doff the donning procedure, I'm gonna put on my face mask, my gown, I'm gonna use the ties to tie at the back. Then I'm gonna put on my gloves. This second pair of gloves would act as if it is an industrial use gloves. So I have 3 instruments that I'll be using today. They are all used, this one is used for cutting, and they're all used for cutting. And as I'm scrubbing them or sanitizing them, I will be looking for any blood, any tissue particles or anything, and I'm also going to be looking for damage. If they are damaged, they would have to be discarded. So this will be my sanitizing zinc. And I'm going to be moving from clean to dirty, to clean. So I'm just going to take my scrubber and just scrub the instrument. And I'm ensuring that there is no debris, there is no damage to each instrument whilst I'm scrubbing. As I'm scrubbing, I'm just taking my time to inspect the instruments for damage. And also, while sanitizing or in the sanitation room, There should be proper lighting and proper ventilation for fumes, and the lighting should be proper in order for the individual that's doing the sanitization to see the instruments properly. Okay, so once we have scrubbed the instruments, they'll be rinsed. Once the instruments are rinsed, I will place them in the clean section to dry. So for demonstration purposes, we're going to pat them dry, okay? Once they are dry, I inspect them for any particles of blood, body fluids, or tissues to make sure that they are properly sanitized. So once the sanitization process is done, I will remove my outer glove and discard of it into the biohazard bin. So now we'll move on to the step of disinfecting. So I have here the high-level disinfectant periactic acid, where the instruments will be placed fully submerged for 30 to 40 minutes. I will also disinfect my zinc that I use to sanitize. Once the 30 to 40 minute mark has come, I will take my instruments out of the disinfectant and place them to dry. For the purpose of this video, I will pat them dry just to save time. I will now wrap my instruments for sterilization using my blue paper. This one will be the inner, and then I have an outer. So I place my instruments on the blue paper along with my sterilizing strip that I will put into the packet to know when I finish sterilizing. If it turns black, that means the sterilization process has been successful. Now I'll use the outer layer. And I would be sure to leave a flap so that it's easy access or opening for the physician when it's time to be open. I will now apply my autoclave tape. And the autoclave tape has special markings on it. So once sterilization is done and successful, those markings will turn black. So once my package is complete, I will place the package into the sterilizer. And I would start the sterilizer using the prompts on the sterilizer. Once the items or the autoclave machine is complete, you open the autoclave, it's going to be warm. And once the autoclave process is complete, the tape should look like this. So it should have black indication that the sterilization was done. Also, we would write the date of sterilization on the package and the contents that the package contained. So today I'm going to use a C-section kit. So I would write today's date. And C-section. So anyone picking it up will know that these are the supplies for a C-section and the date it was sterilized. Once that process is done, I would now doff. So I would doff first, starting with my gown. So I will remove my gown. And I will dispose of it in the biohazard bin. Next, I remove my gloves, which would also be disposed of in the biohazard bin. Then I will remove my mask, paying attention not to let my mask touch my face, and bring down and dispose of in the biohazard bin. To complete the process, I would again wash my hands. Then I will dry. Thank you for watching my video, and I hope you guys enjoy. Thank you.